then you will most likely need insulin injections. So the other causes, well, the other classification of diabetes includes gestational diabetes, whereby diabetes first detected during pregnancy, and there are other forms where, for example, if you take a lot of steroids for any condition whatsoever, then you can develop diabetes. So now comes the important question: how does diabetes actually cause damage? Okay, so this is actually an artery. Imagine it's a blood vessel. Okay, so you have lots of blood vessels in your body, to the hands, to the brain, to the legs, to the kidneys, around the heart. You have blood vessels. Okay, so every single part of your body, there will be a supply of blood vessels to actually make sure that it works. Okay, and so what happens in diabetes? So what happens with these blood vessels? So with heightened blood glucose levels, with the condition called diabetes, with high sugar levels, the diabetes actually damages the lining, the internal lining of the blood vessels. Okay? The internal lining of the blood vessels, what we call endothelial cells, gets damaged because of the high glucose levels that's persistent in the blood. So glucose, when it's too high, when it's of a higher level in the blood, it will cause damage to the endothelial cells. And because endothelial cells covers every blood vessel in the body, the brain, the kidney, including the pancreas, the nerves, so all these organs can be affected. So from head to toe, everything can be affected. So we all know that diabetes has a multitude of complications, many complications. So they can actually be divided into what we call macrovascular, so when it affects big blood vessels within the body, or microvascular, when they affect the small little blood vessels in the body. So in the brain, okay, this is manifest as a stroke. Okay? So when the blood vessels to the brain, it blocks because of damage to the endothelial cells, you can get a stroke. In the heart, you can get a heart attack when the blood vessels in your heart clot, or if there's stiffening of the heart muscles, okay, you can get heart failure. And with heart failure, you can get water in the lungs, you get swelling in the legs, and this is also part of the complications of diabetes. And of course, the dreaded amputation associated with diabetic leg problems. Okay. And microvascular disease, okay, you have eyes affected by retinopathy, it can cause blindness, and of course kidney failure. And the nerves are all surrounded by blood vessels as well. You can get numbness in the hands and feet, and you can have problems with your pulse and blood pressure. So diabetic nephropathy in the kidneys, damage to these cells manifests as leakage of protein in the urine, and with chronically elevated sugar levels in association with high blood pressure. So when you have high blood sugar levels, high blood pressure with shear stress, your blood vessels are damaged even faster. And in the kidneys, you will get diabetic nephropathy. Okay. So what are risk factors for renal disease? Race, Malay ethnic seems to have a high preponderance. Family history, high blood pressure, high blood sugar levels, if you're older, if you're male, and if you smoke. So this is a timeline for type 1 diabetes, okay? And because it is more delineated. So at the onset of diabetes, okay, there are functional changes. The kidneys grow in size, there's some albumin in the urine. So albumin is a type of protein, a simple protein in the urine, that is normally not present, but in diabetes, you can get this leakage of albumin. Then over a 2 to 5 year period with diabetes, you get some structural changes whereby we can see under the microscope, which is still not apparent. Okay, and in this stage, at 10 years, 20 years, 30 years, you get incipient nephropathy, whereby there are no symptoms. So, but at this point in time, the kidneys are actually working hard. There's increased filtration. The kidneys are working very hard to filter out your toxins. There's microalbuminuria, so more amounts of this protein, albumin in the urine. and there's development of high blood pressure. And with the onset of protein urine, so when you get frothy urine, you get overt nephropathy, and at this stage, you're more likely to have problems with symptoms with leg swelling. And with this, you have rising creatinine, which is a byproduct of your muscle that is excreted in your urine. Okay. So with rising creatinine, that means your kidney is failing. Okay. And symptoms start. And by 15 to 20 years, you get end-stage renal disease. So this is actually type 1 diabetes. Type 2 diabetes is not as delineated, okay? Because what happens in type 2 diabetes is that patients usually present here, okay, at 10 years. And because predominantly type 2 diabetes, at the start, diabetic patients are asymptomatic, you have no symptoms, and only through a screening process, then, oh, you have diabetes, or suddenly you lost your vision, or things look cloudy, and you go to the eye doctor, and they say, oh, your eyes are affected by diabetes. So a lot of these diabetic patients already have fairly advanced kidney problems at the start of diagnosis of diabetes. So the important take-home message here is microalbuminuria, whereby there's small amounts of protein or protein in urine. If this is detected early, then there is possibility of actually reducing the onset or reducing the progression of diabetic kidney disease. So excellent blood glucose control is important, early detection of microalbuminuria, adequate treatment of blood pressure, and timely referral to a kidney doctor. These are all important in the management of diabetic kidney disease. So the earliest evidence of diabetic nephropathy is microalbuminuria, and this can be easily detected by your general practitioner if, let's say, you have diabetes, okay, with a dipstick. And overt diabetic nephropathy, so with symptoms with albuminuria, develops over 10 to 15 years. And when this happens, kidney function will deteriorate. It will deteriorate at 2 to 20% per year. And this is dependent on blood pressure control, dependent on blood sugar control, and dependent on what treatment has been instituted. And up to 40% of diabetic patients, type 2 diabetic patients, will develop nephropathy at some stage. In type 1 diabetic patients with overt nephropathy, 50% will reach end stage within 10 years in the absence of treatment. And to reiterate, type 2 diabetic patients, most would have evidence of diabetic nephropathy at or shortly after presentation in view of the relatively silent nature of the disease. Okay. So in conclusion, diabetes mellitus as a chronic disease is increasing in numbers worldwide, and this is the same case for Singapore. Diabetes affects many organs in the body and leads to significant healthcare issues, whether monetary, whether it will affect socially, your family and all that. And how diabetes affects the kidney is complex. The onset of diabetic nephropathy, especially in type 2, varies but tends to occur early in the diagnosis of diabetes itself. Hence, the importance of screening for microalbuminuria for these low amounts of protein in urine. And early attention to diabetes and treatment of microalbuminuria are essential in slowing the progression of diabetic nephropathy. Thank you.
Thank you, Dr. Jason Choo.